about the useful of antioxidant combination products for chronic fatigue syndromes. Chronic fatigue syndrome is a disorder in which fatigue and malaise of unknown cause persist for a long period of time. Along with several fatigue and malaise, sleep disturbs for a long time, making it difficult to lead a healthy social life. Chronic fatigue syndrome is a complex combination of factors such as infection and excessive stress in daily life. It can cause abnormality in the immune system, brain, and neurological function. However, the pathogenesis mechanism has not been clarified and no treatment has yet been established. Previous reports of improvements of chronic fatigue syndrome by antioxidants include anti-fatigue effects from H2 and improved anti-fatigue and quality of life effects from the combination of serine and coenzyme Q10. Antioxidants expected to improve fatigue in chronic fatigue syndrome. The antioxidant compound used in this study is Twendee Mtcontrol. It contains 15 activity ingredients, all vitamin and amino acids, the basic need for our body in small amounts, and the formula have passed the safety test shown here. This is the free radical scavenging ability of Twendee Mtcontrol. Twendee Mtcontrol scavenges not only hydroxy radical, but also methyl radicals and superoxidative radical in concentration-dependent manner. Twendee Mtcontrol also works on intentional microflora. This is the intentional microflora inhabit human subjects. There's a change after the 6 subjects who had relatively high percentage of bad bacteria before taking Twendee Mtcontrol. Taking after, bad bacteria decreased and good bacteria increased. A total of 23 people, 5 men and 18 women, diagnosed by doctors with chronic factor syndromes, took Twendee Mtcontrol for 2 months and asked to complete a questionnaire about their symptoms before and after the treatment. This question asks if participants have even used supplements to improve chronic fatigue syndrome. How use supplement in search of improvement? Probably no benefit as has been obtained to date. This is the impact of chronic fatigue syndrome on daily life. Participants were asked to rate themselves on a 6-point scale, with 5 being most affected. Before taking Twendee Mtcontrol, more than 19% answered affected, and no one answered not affected. After taking Twendee Mtcontrol, not affected increased and most affected decreased. This is the fatigue. About 80% answered affected. No one responded not affected. But after taking Twendee Mtcontrol, Just under half of the respondents not affected, and the number of those who wasn't affected at all increased. The next is muscular pain. More than half of the respondents were quite affected. After taking mitochondrial, about half of respondents were not affected at all, and no one said affected. This is the joint pain. 75% of the respondents said affected. After taking Twendee Mtcontrol, however, nearly 70% say it does not affect them much. Sleep disorder. Despite feeling fatigue on daily basis, all affected in their daily lived by sleep disorder. After taking Twendee Mtcontrol, about half of the respondents said it did not affect it, and the number of those who said it affected them the most decreased to 9%. Memory and concentration are felt to be quite affected by 80% of the respondents. After taking Twendee Mtcontrol, the situation was reversed from before, with more than half of the respondents feeling less affected. Headache are significant after 75% of the population. Here, 75% of respondents are now hardly affected at all, reversing from before the dose. Comparing the mean severity score for all symptoms before and after, all showed significant reduction, indicating that the patients improve considerably after taking Twendee Mtcontrol. As for the number of days from start of dose until improvement is felt, 2 days was the quickly response. Other respondents said that they were able to move quickly when they woke up in the morning after about 3 days, and that they felt lighter after 5 days and 1 week. The results showed that the effect was felt after 5 weeks at least. Other items that showed improvement after taking Twendee Mtcontrol: the waking up better, sleep better, less like to catch cold, less back pain, deeper sleep, less fatigue on waking up, recover from fatigue faster, feel less mentally depressed. So conclusion, chronic fatigue syndrome affects daily life by presenting with multiple symptoms. Twendee Mtcontrol has the ability to scavenge not only hydroxylated radicals, but also other radicals, and suppress oxidative stress in the body. It is also expected to regulate it in interest involvement by lowering oxidative stress. Various symptoms of chronic fatigue syndrome are related to oxidative stress. Twendee Mtcontrol improves not only the fatigue, but also various other symptoms such as malaise, muscle pain, joint pain, sleep disorder, memory and concentration problem, and headache is chronic fatigue syndrome by combining a number of active ingredients. No cases have even been shown to be effective in improving many symptoms of chronic fatigue syndrome. And Twendee Mtcontrol may be an aid in prevention and treatment. Thank you. Thank you.